In this deformity correction tutorial, we review other wizards in the deformity group. On the individual long bones of the lower limb, if the planning icon is selected, some other wizards appear. Opening this image and scaling using confirm oversize, as we are measuring angles only. In the planning screen, along with the tailor spatial frame wizards, which will be reviewed in another tutorial, we have the Blounts disease wizard. Select this wizard to measure either the femorotibial angle or the metaphyseal diaphyseal angle. There are two parts to this wizard. Firstly, two connected lines in a roughly vertical position and one horizontal line. The two vertical lines are designed to measure the femorotibial angle. Place along the shaft axes as appropriate. However, if you use the tibial section and the horizontal line in conjunction, measure the metaphyseal diaphyseal angle. The long axis of the tibia may be defined either in the mid shaft, or the literature also suggests on the lateral cortex. The user can define whichever axis line they feel is appropriate. And the horizontal component is designed to sit at a point at the proximal tibia at a line parallel to the metaphysis. And this will sit across the metaphyseal beaks if they've formed. The angle of 12 degrees is then shown as the MDA, representing the angle between the line drawn parallel to the proximal tibial metaphysis and another line drawn perpendicular to the long axis of the tibial shaft identified. Either use or ignore the tibiofemoral angle depending on your interest. If you want to draw the MDA on the other side in comparison, go to Add New Procedure, choose the other side of the body, add that procedure, and then apply the wizard, positioning in a similar way. There are two other wizards associated with angular long bone deformity, and we will review those on another image now. If the planning icon is selected in the elective procedures blue man, two wizards appear: angle and offset and shaft fracture angle. They can also be obtained by going to more wizards and choosing from a long bone area, selecting and adding to the list. They've already been selected, so it's not possible to select them again. These have already been positioned just for the speed of demonstration. Angle and offset allows the user to adjust the two components of the wizard to outline the long axis of, for example, the fractured segments of the humerus, and shows the offset. Shaft fracture angle does a similar job but allows exact identification of the cortex of both fragments of bone and gives the angle. Measurements can be saved or committed as needed. They're shown here in the report panel on the left, and that completes the tutorial on other deformity wizards.